Okay. Does that hurt you to bring it up?
No.
Now this is where we need to be sensitive with her because of the strain in the muscles here in the hyoid bone. So we want to, you know, if we're going to adjust her neck, be very gentle here with her. Hello folks, if you have pain when you swallow, or did you have any other symptoms?
Yeah, so I had pain here when I would swallow that would go into the upper area of my throat and jaw.
Okay.
It would come down
Okay.
into here.
Into the trap there.
And then into my shoulder blade.
Shoulder blade. Okay. So she has a hyoid bone subluxation, and the hyoid bone is a U-shaped bone that sticks right here up at the top of the pharynx, and that bone sort of floats, and it sits in front of C3 and C4 vertebra. But the complicated issue with it is oftentimes it's got so many ligaments and tendons that are attached to it, about 16 if I remember correctly. And all of those ligaments and tendons are some of them are very small. They're intrinsic muscles in the neck. But when she told me that she swallows, she has pain right away, I kind of figured there's probably a muscle weakness in one of the hyoid bones, or excuse me, one of the muscles that attaches to the hyoid bone. So one of the ways that we check that is go ahead and pull your mask down and stick your tongue out. And if you notice, her tongue deviates to the left. Okay, so that tells me that she's got a weakness in some of the muscles there, and we're going to go ahead and strengthen them. And what I'm going to have you do is stick your tongue to the left side, to your left inside of your
Mask on or off?
Mask. You can keep.
I don't know if you want.
Go ahead, mask off.
Okay.
And stick it into the right cheek, so like that. Okay, and do you have any pain or discomfort?
A little bit.
Okay, and go to the other side. It's a little bit harder to do it to that side.
Mm-hmm.
So I'm gonna have her doing exercises like this. And pushing her tongue towards the left. And it seems like, wait, her tongue deviates to the left. You don't want to do that. But it actually is difficult for the tongue, the muscles on the right side, to push the tongue to the left. So we're going to strengthen those muscles. We're going to do some other strengthening exercises for her. But clearly, that's a weak muscle there on that right side, and the tongue should not deviate. We're going to adjust her neck gently. We also did some laser. I'm going to show you guys how we go about lasering this, but it's probably just a bit of a muscle weakness and a muscle strain, and she had this after an adjustment, so it can happen. She also came in with some neck pain and some eye pain.
Yeah.
Right? So I believe that she does have a case of occipital neuralgia and trigeminal neuralgia. She's also got some TMJ pain in the jaw. So there's a lot going on here. We're gonna send her home with a laser, and we showed all the points. She's gonna laser. Go ahead and lift your mask up a little bit.
Should I do it this way?
That's good. Okay. Now we're gonna go ahead and laser all under here, under the jaw, where all the muscles, the ligaments and tendons attach to the hyoid bone. So she's gonna be lasering all under there. She's going to be lasering the SCM muscle, stylohyoid muscle, all the muscles that attach into there, and some of the intrinsic muscles. And by inhibiting the nerves, especially the occipital and trigeminal nerve, which she's doing on the left side. So when you put the laser right up here and here, that's getting the trigeminal nerve. It comes up right over the ear like this. Okay? So the occipital nerve is back here. So you're going to take the laser. Yep, you're going to take the laser, and you're also going to put it back here on the back of your neck. So you did over here. You're going to go back here, right here, here. Just go across the bottom ridge. Again, 2.5 minutes on each spot, and that will get the occipital nerve and the trigeminal nerve, and you'll also get it up here when you put the laser up here. Okay. Your TMJ joint is in here, so I might, if I were you, I would go a little bit higher with the laser. It's a lot of spots to remember.
Yeah.
Realize that. Okay. Go ahead and lay on your stomach. Okay, so you said you were having it into the right side, right?
Yeah.
So you can take the laser and put it right here, 2.5 minutes on all these points here, these trigger points in the back here. I would say just that one and that one are key for you. Then you're gonna, again, come back here, 2.5 minutes. You could do it right in the center, 2.5 minutes, and 2.5 minutes there.
Okay.
Any questions about that? Okay. How's your lower back?
It's okay. It sometimes feels like a little, like I'm extended sometimes. I don't know how else to explain
Tighter
it.
on the right side than the left usually? Left than the right, I mean?
Yeah.
Okay. Let's start with this side up.
So turn on to my left side?
Yeah. You turn on to your left side, yes. Okay, and bend this leg here, straighten your bottom leg. Okay, and the other side up.
I feel like that pops so easy.
Does it usually
I don't
adjust
know.
pretty easily? Usually, you've gotten upper cervical work in the past, right? Upper
Yeah.
cervical chiropractic? Okay. Okay. Lay on your back.
I needed that.
Have you had any headaches in the last 72 hours?
Just my occipital headache that doesn't
Okay.
go away ever.
Okay. It will with this laser. So twice a day, I want you to do all those points that I gave you. And don't forget, right above the jaw on the left side, up here. Do you get the headaches on the right side or the left side?
Just left side always.
Yeah, I really believe all of this is related. Her TMJ, the hyoid bone issue, the eye pain, the headaches, the neck pain, all of this, you know, everything related. Cross your arms, tuck your chin, deep breath in, come on up. And blow out. Okay, tuck that chin again, deep breath in, keep it tucked. Bring it up, yep. Does that hurt you to bring it up?
No.
Now this is where we need to be sensitive with her because of the strain in the muscles here in the hyoid bone. So we want to, you know, if we're going to adjust her neck, be very gentle here with her. See, that was it.
That was
And you
gentle.
probably heard that. It was pretty loud. All I had to do was rotate her neck. I didn't even have to really do any thrusting there. So that tells you that it was really out of alignment there. Now, I want you to go ahead and sit up, face the camera, and swallow for me. Tell me if you have any pain swallowing.
I sip my water, my mouth's
Sure.
really dry.
Sure.
It's not as bad, but it's still in this upper area that I
Okay.
feel it the most.
Well, you're gonna take that laser home with you. You're gonna laser that whole area there. And we did this muscle right here. So if you feel it's more in the front,
Yeah.
you could just angle it a little bit more to the front, okay?
Okay.
But by the end of the week, you're not gonna have that problem anymore with that, once you take that laser home with you, okay?
Awesome.
All right, any questions?
No, I
How
think
about you guys? Any questions or comments? Make sure you comment below. And thanks for tuning in.